feeling sick, you need to stay home and limit your activities. You can go to coronavirus.dc.gov at any time to see where free testing is available. Let me ask Dr. Nesbitt to talk a bit about on the vaccine distribution, and the numbers are reflected on this slide. We're all happy to see that we have now received over 100,000 doses, administered over 90,000 doses, and as promised, we are now seeing increased weekly shipments. And Dr. Nesbitt, if you would talk about those numbers as well as where we are for last week and this week.
Sure. Thank you, Madam Mayor. As the mayor has mentioned, over the past 5 or so weeks, we have seen an incremental increase in the number of doses that we've received in the District of Columbia. Sometimes that increase has been of Moderna only, sometimes it's been of Pfizer, and sometimes it's been a combination of both Moderna and Pfizer vaccine. This allows us to increase the number of district residents and essential workers for whom we are initiating vaccination on any given week and support our special initiatives as well. Many of you know that last week was a very difficult week in the U.S. in terms of inclement weather. With the vast majority of states in this country experiencing inclement weather, including major commercial transportation hubs in Tennessee and Kentucky. In addition to that, a major distributor of the vaccine was also impacted, with essentially its employees being snowed in and unable to get to the facilities to be able to distribute vaccine to many jurisdictions. The District of Columbia was impacted by that. It did cause some of our hospital and healthcare providers to have to cancel first appointment clinics in the District of Columbia. We were able to prioritize continuing vaccination clinics that were scheduled through the centralized portal system. So no individual who scheduled an appointment through vaccinate.dc.gov was impacted by our lack of receipt of vaccines as scheduled last week. We are scheduled to receive our shipment from last week, early this week, as well as the 17,590 doses that the mayor mentioned we are scheduled to receive this week. Because many of the healthcare providers who are already enrolled in our program are not operating at capacity because of the limited number of vaccines that we receive, although increasing, still limited, we are not at a place in this time where they will have to necessarily schedule additional days of vaccine clinic, but being able to accommodate more individuals on the already existing days. Again, individuals who had appointments scheduled with hospitals and health centers will be notified directly by those hospitals and health centers of their rescheduled appointment dates and times, and no individuals who had an appointment in the district's vaccinate.dc.gov portal scheduled that way was canceled. So just want people to be mindful of that. Thank you, Madam Mayor.
Thank you, Dr. Nesbitt. And also another initiative that Dr. Nesbitt's team is leading is with faith-based communities in the district to partner with the city in distributing vaccine from their locations. So New Samaritan Baptist will be our second faith-based partner in distributing vaccine. And so I want to thank all of those who are working together to make this possible, including Mary Center, 5 Medicine, Learning Undefeated, Black Coalition Against COVID, and the Leadership Council for Healthy Communities. Faith and Vaccine is one of the initiatives you heard Dr. Nesbitt allude to help reach more Washingtonians. And another of those initiatives is with the DC Housing Authority, where we are working with their senior properties. And vaccinations are taking place at 14 DCHA properties. Already 912 people have been vaccinated at these 11 sites, including residents, staff, and other qualifying seniors. And I believe this is a partnership with Sibley Hospital at DCHA. So now we want to turn to recovery and recovery updates. And I would like Director Morris Hughes, who is the leader of the district's Department of Employment Services. She and her team have been working nonstop throughout this pandemic to help DC workers who have lost jobs because of the pandemic. Obviously, the unprecedented nature of this pandemic has taxed our not only the funding for unemployment, but the systems that support unemployment payments. And unfortunately, last week, there was a glitch in that system that caused many thousands of people to have missed a weekly payment. So Director Morris Hughes is here to talk about where we are with that fix and who's been impacted and looking forward. Unique.
Thank you, Madam Mayor. So last Thursday, February 18th, during our ongoing system updates of the Continued Assistance Act, the unemployment insurance benefit system experienced a technical issue. As a result of this technical issue, approximately 39,000 UI benefit claimants were not able to receive their weekly payment due to this issue. Once alerted by our third-party vendor OnPoint, our team, internal to government, and our vendor went immediately into action to determine the cause of the issue and the solution of the issue. I'm pleased to say that not only have we identified the issue and replicated the problem, but we have deployed code changes and resolved this issue. What that means is that all of the impacted claimants that did not receive a payment should expect to receive a payment within 2 to 3 business days. So that means between Tuesday or Wednesday, based on their financial institution, they will receive a payment. What we have learned is that we are going to make sure we work with our vendor even closer than we have before to continue to test the system to ensure that no other technical issues like this occur. We're also currently looking at a cloud or web-based solution to implement to support our current UI benefit system. And then last, we are completing the RFP process for the unemployment insurance benefit system to replace our legacy system. Thank you, Madam Mayor.
Thank you, Unique. And finally, I just want to remind people that DMPED and the Department of Small and Local Business Development are working with the business improvement districts in Anacostia and in the downtown to provide free PPE care packages to DC businesses. Pickup dates have been extended to accommodate the difficult weather we had last week. If you are a local business and need a PPE, you can fill out a form at coronavirus.dc.gov/phase 2. So with that, we can take some questions. Yes, Sam?
Yes, Mayor. So you did note the 500,000 nationally, and I guess the city is approaching 1,000 for you or Dr. Nesbitt or whoever. But as you approach this I guess milestone, any thoughts about stuff you might have done differently, or thoughts that maybe you did the right thing in this area or that? I'm just curious.
Sam, if you're asked, well, I'm not sure how to answer that question other than I'm very proud of our team. I'm proud of our response, and I'm proud of DC residents and businesses who have sacrificed a lot to help us make sure that our healthcare system can accommodate people who need help because they've been impacted by COVID. So when I look at those numbers, I know that we've been able to do that, that we've been able to make sure anybody impacted has a doctor and all of the professionals and equipment that they need.
any regrets, things you might have done differently, you think?
Go ahead.
So, Sam, it's an interesting question. And I think as a physician and a public health practitioner, anytime a life is lost, any person's life is lost, you always ask yourself, is there anything I could have done differently? We are in the 12th month of a pandemic, and our approach to population health management, health improvement at DC Health is to be in a continuous quality improvement phase. And so the way that we have approached this work is to, on a daily basis, ask ourselves, how can we do better and how can we get better on a daily basis? So it's challenging to answer your question on the surface in terms of, are there any regrets? You regret that any life has been lost in this country, period, whether it's been a district resident or any of the Americans. But we aspire on a daily basis to make sure that we can reduce and minimize the amount of life that is lost. So every guidance document we publish, we review it to ensure that it is up to date in terms of the science. All of the guidance that we provide here, and the reason why we're probably one of the only jurisdictions still coming to the public twice a week, is because we want to make sure our public remains informed and we're being extremely transparent about what it takes to remain ahead of this thing. And I would say that the mayor has done an awesome job at being a role model for her colleagues in terms of balancing the tremendous toll that it has had on our health, our physical health, our emotional health, our mental health, our spiritual health, our financial health during these difficult times. So, our approach again is to just be in a continuous quality improvement phase and ask ourselves every day, how can we be of the best service to the residents of the District of Columbia?
Thank you. And Mayor, looking back, she mentioned financial health. Just curious, your thoughts. A year ago, when I guess the CFO came and told about the situation, how dire it was, it doesn't seem that the city is in as bad a financial shape as you might have thought, or at least as I would have thought. But what are your thoughts there?
Some people aren't, and some people are. Some people haven't had any impact on their finances, and in fact, in some ways, they may be better. And some people have been totally obliterated by this pandemic financially. They've lost businesses and they've lost work.
I was speaking more about the D.C. government. But
Well, I'm getting there.
Okay.
And because it's uneven, we haven't been as impacted if it was an across-the-board loss for people. So we've lost visitors, we've lost sales tax revenue, but our property tax revenue and our income tax revenue have not been as badly as affected as predicted last year. But having said that, Sam, we still don't have people at work in our downtown. We still don't have our nightlife and entertainment fully open. Hospitality, fully open. And we need to get beyond this virus so that all of those things can be enlivened again. Yes.
Good morning, Sierra Fox with Fox 5. Thank you so much for addressing the unemployment compensation technical issue. Now, a lot of people say that I've spoken with, they rely on this money, and a lot of them, their bank accounts are overdraft or they don't know what to do. Is there any additional support or services being made available to these people during this time while they wait?
Well, we want them to know that those payments we expect on Tuesday and Wednesday of this week, and we expect this week's payment to be unaffected. And so we terribly regret that this happened, and we have a system we're asking it to do a lot of things to accommodate these new programs and beneficiaries. And we will get that payment out to them just as soon as possible.
If they're in need of food or anything?
We have quite a lot of resources available at coronavirus.dc.gov as we've had throughout the pandemic. Thank you for that question. Yes?
Is there any offer of covering people's fees if they had overdraft
No,
fees?
it's not.
No. Okay. Can I ask a question for Dr. Nesbitt also? I wanted to see, now that we do have a number of people in the city who are vaccinated, whether there's any update to the travel guidance. Should people who have the vaccines still quarantine when they get home from traveling, wait 3 to 5 days, get tested, need a negative
They
test?
should until we make an update.
So it's
but
all
it
the
is-
same
It
regardless?
is correct until we make an update. And when we make an update, we'll provide that information here.
Thank you, that's very helpful.
Yes.
Daily case rate and just, what you make of this. And do you know the date of the last time that the daily case rate was in the yellow? It was not in red? And my follow-up to it is, at the same time you're seeing the testing is down, is that part of the reason daily case rate is down? Can we read one thing from the other?
So I don't know the exact date for the daily case rate having last been yellow or solidly in phase 2, but it was sometime in November. I want to say early to mid-November. At the same time, as you've alluded to, last week, our testing citywide total numbers were around 25,000. Which is the lowest number of total tests citywide that we've had since the last week of September, first week of October. So the total number of tests that we're doing per capita is much lower than that build of 30,000, 35,000, and then getting over 55,000 tests per week we had between October, November through the holidays, December, and being sort of sustained at 45, 50,000 tests per week. And now we're back to, last week we were at 25,000, and we hadn't experienced a low like that since the end of September. It's important for people to remember that 45 to 50, 55% of cases occur in individuals who do not have any symptoms. Which is why we encourage people who have symptoms who are not in their usual state of health, because for some people, the signs and symptoms of COVID-19 can be loss of taste and smell, a headache, generalized body aches, but people who are not in their usual state of health would proceed and go and get a COVID test, because that allows us to do the boxing in strategy, to isolate them. If they have a positive test, identify their close contacts, have those individuals be quarantined and not spread the virus to other individuals. When people have an exposure and they don't get tested around 5 days, 3 or 5 days after having an exposure, and they become positive, then they can spread the virus in the community as well. So having the number of tests declined in our community is of course a concern. And if we're not picking up those asymptomatic cases, it can have a direct effect on the daily case rate.
So I'm sorry, your last name?
If we don't pick up those asymptomatic cases, it can have an impact on the daily case rate.
So it is fair to connect the fact that
It is possible that that could be happening. It's not absolute.
Okay, thank you.
One more question.
Yes.
The fence, Mayor, we haven't, are you hearing anything about the fence, when it might come down? What are your thoughts there?
Sam, we haven't gotten any update on the fence. I will tell you, we'll be making some more specific inquiries about the timeline on the fence. Thank you, everybody.